Mary.
You watch the elbow?
Okay, we'll get back on our X's now.
Thank you so much for visiting our Cancer Moonshot area. We represent a team of community health educators, multilingual community outreach workers, and also health communication specialists. We're committed to the mission of reducing the cancer burden throughout our cancer catchment area. And it's my profound privilege to tell you a little bit about our work. We are guided by our community advisory board. Our community advisory board represent key stakeholders throughout this whole entire geographic catchment area. They inform everything we do, from specific policies and programs, for example, with environmental carcinogenesis and breast cancer risk. We use data science methods to find pockets that need the most cancer screening for prostate cancer, cervical cancer, breast cancer screening. We also work very closely with our community partners on some safety programs, tobacco cessation programs, and human papillomavirus vaccination efforts. You're here in Washington Heights, which is an amazing community that has deep roots with great people and culture of Dominican Republic. And over the last several decades, we've had a lot of strides in increasing cancer screening rates through partnerships with the Cancer Center, New York Presbyterian Hospital, and also you see outside some of our community health vans. Yes. We have a breast cancer screening program. And so I want to end with just telling you a little bit about where we focus a lot of our efforts. Here in New York City, we have some of the greatest diversity in the country and the world, and we have multi-generational approaches to cancer prevention. So the youth are the health ambassadors for their families. Often they're the communicators to their families. And so we, as one of our hallmark features of our program, work very closely with training the next generation. And my colleague, Dr. Jasmine McDonald, leads these pipeline training programs. And we have two participants in our program, one proud graduate of our program, and one current participant. And we work with them. They come to our Cancer Center over the summer months, and we're just thrilled that you have the opportunity to be two representatives, and you'll meet a few more later on. So thank you so much.
Thank you.
Yeah.
Are you going to, oh, good. I was going to say, oh, yeah.
So my name is Tatiana. I started the program in 2016 from UT. So a couple years back, I started in 2016 when I was still a high school student at the Bronx Center for Science and Mathematics. I was in Columbia until my freshman year of college. I'm currently a research coordinator in New York City, where I do prostate cancer research, as well as based on the quality of life and health disparities within the prostate cancer research community. That was the work that I learned community to be able to assess the health as well.
How did you get interested in doing this at such a young age?
I was interested in schools. So in high school, I had sort of a question where it's like, do I want to go into medicine or do I want to go into physical science? So eventually I asked, why not? So the final was actually the college where I found public health. I didn't know the physical program, and it's just the perfect combination between population health and the sciences that I'm interested in. So that's why I became really interested in it. Yeah. So I usually do medicine at first, but then once I was introduced to public health, and the impact of the wide community.
Go for the doctorate. Good for you. Good for you.
Hello, I'm Jada, and I'm a senior at New York High School in Staten Island, which is a borough actually known to have some of the highest cancer rates in NYC. Throughout this program, I did clinical research on breast cancer with Dr. John Hirschman's team, and we specifically focused on public health and pharmaceutical approaches to cancer. And coming from low resources myself, this program definitely helped me solidify my engagement in healthcare, medicine, and definitely put me into a perspective to see the day-to-day basis of this field.
Does someone in your family have cancer? Is that why you're interested in this?
So someone in my family did have cancer, specifically prostate cancer, but additionally I wanted to just reach out to my community and help the people around me. So, and I'm also definitely interested in clinical research. I didn't know there was that clinical research existed. I thought it was just going to a lab and bench work, but there's definitely much more to research, and seeing like a patient's progress is like said to be such like a proud moment as a participant.
Yeah, and I'm so glad that you went into STEM, the STEM fields. I mean, I personally would prefer if you like to become an English professor, but really, it's so great to see women going into STEM fields.
And we
Yes,
really want to
young
thank your leadership, because the National Cancer Institute has invested tremendous resources in our program, because we've had such successful graduates like
Yes.
Tatiana and current graduates. We need a few more later. And so the National Cancer Institute now is funding for the next 5 years, Yes in the Heights, which stands for Youth Enjoy Science. And so very much promotes STEM research and staying in cancer research. And in particular, we're expanding our high school programs, as well as now we're in the New York City public schools with courses to teach science, education, and cancer genomics through the Math for America partnership.
How many young people are in this program now actually?
I know this program has been going around for about 6 years, and usually there's about 10 students every cohort.
And then during COVID, we were able to expand to offer online offerings. So daily, we had about 200 students would log on to have scientific enrichment.
Really impressive. Thank you. Thank you.
Thank you.
Thank you.
Okay, great. Thank you so much. Yes, yes. Thank you. Yes, yes. Thank you so much. Yeah, thank you so much.
My colleagues will talk about clinical trials.
Good morning.
Morning, huh?
Hi, good morning, Brianna.
Nice to meet you.
So nice to meet you.
So you Ludo syndrome is that's very good.
So my name is Andrew Lastman. I oversee the clinical trials program of our cancer center. And clinical trials are among the most important vehicles that we have to develop new diagnostics and new therapeutics. Despite that, we are aware of disparities in the participation of clinical trials. So, for example, about 40% of the U.S. population is made up of people from historically underrepresented groups, yet only about 10% of clinical trial participants are from those groups. So we think there are at least 3 reasons why we should address that problem. First, it's the right thing to do, but in addition, by having a more diverse group of people who go on to a study, it makes the results of that study more generalizable. And also by accruing more people from a more diverse group more quickly, it allows the trial to complete more quickly and get results more quickly. We're very proud at our cancer center that about nearly half of patients who go on to our cancer clinical trials are from historically underrepresented groups, nearly half, and we have a number of initiatives underway to also try to continue to improve that. One of those is our participation as what's called an NCORP site, and you may be familiar with the NCI Community Oncology Research Program. We're one of only 14 sites in the country that is a so-called NCORP site, and we put about 1,500 patients onto NCI-sponsored NCORP trials. To do that work, it takes a team, of course, and we have a terrific team of highly dedicated professionals, and with that, I'd like to introduce you to one of those here.
So my name is Brianne Bowden. I started at Columbia Cancer Center as a clinical research nurse, later moved into a role as a clinical trials nurse navigator, and now I am an oncology nurse manager where I oversee our navigation and outreach core that we've built and developed. So we have a team of nurse navigators and outreach coordinators whose goal is to expand access to clinical trials, especially to those from populations that have historically been underrepresented. We aim to make the process of identifying and enrolling in a clinical trial as easy and as streamlined as it can possibly be, while also providing that human contact that our patients really do need and deserve. So I have the privilege of having one of our patients here with us today, Mr. Mario Sambula. Mr. Sambula came to us when standard therapies were no longer effectively controlling his cancer. So I, along with my team, worked to identify a clinical trial for him. We enrolled him in that study, and we've been with him throughout his treatment. He is doing incredibly well, and I'd like to give him a chance to tell you a little bit more. Would you like to share about your experience?
¿Cómo estás ahora? How do you feel now?
Well, bastante mejor. Very good.
Very good.
Doing okay, according to the information from the doctor. So he informed me I have survived cancer now. So I've been in this condition like 5 years, almost 5 years. In that. So far I'm doing okay.
Because it's often difficult to find trials. I mean, people don't even know, a lot of people don't even know they exist.
It's so true.
And so for you, Brian, I mean, to find the trial for Mario is amazing and saved his life. So you have to feel good about your job and what you do.
Our outreach and navigation corps, you know, we are so proud of the work that we do for exactly that reason, because clinical trials, you know, unfortunately, they are not always the most accessible. So that's why it's really our priority to just make that process as friendly as we can.
Yes.
Thank you.
Well,
I'm looking here, please.
Thank you so much. Thank you. Thank you. You continue. Mario.
Small contingent of our research, always the general hospital.
Sorry.
Cancer cases and deaths rapidly increasing in the Dominican Republic. Most common types, prostate, breast, lung, and colorectal.
And the two first ladies.
We have over 1 million Dominican residents in the New York and Jersey area.
Thank you.
In our cancer neighborhood catchment area, as you already heard from Dr. Cherry earlier, we have the highest concentration of Dominicans in New York City. We refer to this strong connection as the air bridge. We hope to build on this foundation to develop deep collaborations. Our comprehensive partnerships include initiatives in clinical care, including increasing genetic testing and counseling, virtual tumor boards, and making referrals for complex treatment cases to our center. Our partnerships in training include bidirectional exchanges of both U.S. and Dominican students for clinical and research rotations. And finally, our research collaboration. One example is a study we're trying to do to identify barriers to colon cancer screening in the Dominican Republic. And recently we submitted an application to the NCI with 2 Dominican hospitals. We're excited about this natural partnership because we believe that it will lead to an elevation or improvement in cancer care, both in our neighborhood here in the U.S. but also and in the Dominican Republic.
Have you identified a reason why the rates are so high? Is it genetic or is it the environment? Have you?
You know, that's a tough question. I think part of it, for example, breast cancer is very common in specific provinces. So Dr. Cherry has some background in that, but especially in some young women in some southern provinces. So that's an area where there may be environmental factors at play. It seems to be some specific provinces and not others. The smoking rates are actually relatively low. So it seems like, yes.
Yeah. And I'll throw this a very interesting.
Okay.
So you know.
We knew before,
Yeah.
and it's amazing in his research on cancer. Because it's not
Yeah, I'm a theoretical physicist by training. So. Yeah, so
Mathematician.
no, my career is still unusual. So I am a researcher here at Columbia. I work with data, and one of the things that has changed in the last few years is that we are getting all this data from different places in the world. We just want to mention some collaboration. We have now very international collaboration. And this is introducing a challenge also. And the challenge is now we have all this data and we have to extract all this information and use this information for predicting something. And there is a revolution now in developing algorithms, developing ways of thinking about that. But traditional training in oncology doesn't have this type of expertise. So I did a group of physicists, mathematicians, people from computer science, trying to address this problem. So we all converged to try to solve these programs. And then we work with many groups. We work with many groups in Spain. Originally from Spain. We work with the National Cancer Institute in Madrid. We've been looking at, for example, one of the problems is why some people develop cancers and why some people don't. In particular, in pancreatic cancer, it's a very deadly cancer. We don't know exactly. We can find a way of identifying something that is done in all these persons going to be more likely to develop that. Fantastic. But for that, we need a lot of data. So we work with our colleagues at the National Cancer Institute in Madrid. We work with data networks in Europe. We have collaborators here in the US and all around the world, collecting all this data and trying to provide something to see what is happening with these patients. And this has been very fruitful collaboration. We are very happy with that.
To share knowledge. Didn't we meet with Letizia? Yeah, in Spain. Maybe that's one of the early books that we had. Yeah. So
Big models how to explain the behavior of the cancer.
Exactly.
Yes.
So now it's really, we're in a very interesting moment. I mean, and universities, large universities like that can provide people with different expertise to create these teams of people.
Yeah, we gotta work harder, we gotta work
We
faster.
wouldn't work fast.
We gotta work faster.
Yeah.
But I love the international collaboration. Really, that's what we need, right? Breaking down the silos. Yeah. Thank you.
Well, thanks so much.
Dr. Bryan, how did the two of you realize your mutual interest in cancer? How did your partnership come together?
Can you talk more about this program?
Yes, I have the honor of being the director of the Herbert Irving Comprehensive Cancer Center at Columbia University and New York Presbyterian Hospital. And we have programs that span a spectrum from on our campus to community outreach and engagement throughout New York City, but especially in northern Manhattan and South Bronx. But then we extend that to collaborations nationally and as well as programs globally. So today's special event was an illustration of the collaborations that are ongoing between our cancer center and programs in Spain as well as in the Dominican Republic. But we have many other global programs in Africa, in South Asia, Far East Asia, South America. And we think this is extremely important because we want to share insights and information from our research and approaches to patient care. And at the same time, we want to learn from examples in other countries as well. So truly, these are partnerships that are bi-directional. And the progress that we make hopefully can be applied in other countries. The progress that's being made in other countries we can learn from and apply in our environment.
Yeah, one of the things that is very, very difficult is funding for cancer research. And in places, as you mentioned, as in Africa, developing and emerging countries like in Africa, in Southeast Asia, what can they do?
Yeah.
Especially, in that part of the world, there is an increase in cancer.
Yeah,
among women.
Cancer incidence is increasing across the entire world. Some of those cancers are because of factors that are unique or intrinsic to that country. Some of it is with changes in the environment, the diet, the lifestyle. Then common cancers seen in the United States are becoming common in those countries. So with that in mind, funding is challenging, but the National Institute of Health and the National Cancer Institute does support partnerships for funding possibilities. So we do take advantage of that. The second thing is we're increasingly working with governments in other countries to try to influence the funding landscape in other countries. And third is through our own resources, we try to devote funding in other countries as well. So I think there's no one solution to the funding issue, but it's a compendium of several solutions.
So your advice to governments in those countries would be to invest more in their health?
Yeah, yes, and you know, the benefits are tremendous because the improvements in cancer burden help individual national economies. It's less burden on hospitalizations, utilization of technologies, and early mortality, as well as prolonged morbidity. So all these have costs that multiply as a consequence of the cancer burden. So by investing in these types of efforts, governments can also derive benefits that go beyond diminishing the cancer burden, but helping with the very rubric of the economy in that country.
Yeah, one of the things that you talk about, and the First Lady also talk about, is the mobile treatment center that you guys have outside. Is that something that you think might be replicated in developing in developing countries?
Yeah. Thank you for noticing that. That means a lot.
To provide more testing.
Yes. So what you're referring to is credit to our Columbia University School of Dental Medicine. They've designed and constructed 2 mobile buses. One of them is purely for dental medicine, so oral health, oral cancer screening. The other is a combination of dental health plus screening for other cancers in terms of giving advice, breast, colon, melanoma, lung, cervical, and so forth. So this is a way for the buses to get out in the communities, especially for people who may not have, who have limitations in even coming to our clinics and hospital. I think this is a way with mobile buses of using that model throughout the United States, but especially throughout the world.
In developing and emerging
because
countries.
It's a way to scale, to reach many people who may not have the resources or who cannot travel, or both. And I think this is extremely exciting, and I personally am even more passionate about this as a tool, as a platform for cancer care and cancer delivery.
What is your message to women in development, actually globally? What is your message to women in terms of, getting tested, because we're still seeing that increase, and given what happened with the pandemic?
It's very important for women and men to get screening for about 6 or 7 cancers, which are prevalent for average risk. There are other cancers which are more prevalent in high-risk people because of genetics. But for average risk, screening for breast cancer, lung cancer, colon cancer, prostate cancer, cervical cancer, and skin melanoma. All of these are absolutely critical. And if one thinks about it, the screening measures are not that complicated, but it's a matter of distributing them throughout different countries in the world. That's what we have to attack and overcome.
Okay, thank you very much for talking to me. Thank you.
Thank you so much.
Thank you.